flexor tightness. We're going to be seeing if she has one joint hip flexor tightness, two joint hip flexor tightness, or both. So I'm going to ask my patient to lift her untested knee. So we're going to lift that left knee, and I'm going to help her come down to the table. And the first thing I want to see is if that thigh touches the table. So if the table were to extend, it will be right there. So her thigh definitely does not touch the table, so there's some tightness in there. So I'm going to try to take the rectus femoris, sartorius, all the two joint hip flexors out. So I'm going to extend that knee and then we're going to bring the thigh down again. And now the thigh does touch the table. So that means that there is no one joint hip flexor tightness. If there were, it would look like this. And the thigh just wouldn't go down. Up next, we want to see if there is that two joint hip flexor tightness. So just letting her come down like this, we want to see if the knee is able to get to 80 degrees. So we'll measure. And she's at about 60, so she's not able to get to that 80 degrees of flexion. So there is some two joint hip flexor tightness. So what I want to do is look at it from this point of view, and I can see that her hip is abducted. So we're going to bring that hip in, lift it up, bring it in, and then we're going to try to bring that hip down again, and we're going to take notice of her feet. So if I bring it down, you'll see that knee extending, the feet coming out. So that probably means that she has some TFL tightness. If her sartorius was tight, if I bring it down, that knee is going to come into flexion. But this patient has two joint hip flexor tightness along with rectus femoris and probably TFL.